Our maternity patients are often very young. Only about half the women can read. Many of our patients are uneducated in how to take care of themselves, and they're also very poor. They often might have a thatched roof hut that they're taking these babies home to. Their blood counts are so low that in this country we would probably give them a transfusion. Babies often are anemic if the mother's anemic. They're underweight. The added stress on their bodies of a pregnancy is very difficult. They don't know how to give baths. We have babies come back to the hospital that haven't been bathed in 10 days. So the babies easily get infections, and those infections spread throughout their whole body very fast, and they become deathly sick. Severe jaundice is a problem because they're not feeding the babies properly. When they feed formula to the babies, they'll mix it with unclean water, and the babies quickly get severe diarrhea. It's a huge and very dangerous thing. Many children die just from diarrhea. We only have this very small window of time while they're in the hospital for them to learn about how to take care of themselves and how to take care of the babies. And in the ward, it's just chaos at times. We might have 5 deliveries in one day and 2 nurses to take care of all the patients after deliveries, as well as do the deliveries, as well as take care of the babies. The nurses will stand up and try to shout over the bedlam that goes on in the ward. And meanwhile, all the families are milling around and toddlers are running around the ward. Since they're illiterate, we can't just hand them a pamphlet and say, please read this, and if you have any questions, ask us. So there's no time in their day for teaching. We're hoping that making a video will be an opportunity to teach these ladies how to take care of themselves after they go home, how to take care of these babies. A video made here in the U.S. would definitely not work in this kind of situation. If a video is made there on site, not only will it have the national people in it, but it will also have their environment. Plus we'll have native Hindi speakers, and they can relate to the videos. We want them to see this is something for us. It's horrible to watch mothers come in and die in the hospital from anemia because they didn't know how to take care of themselves, or to watch little infants die because the mother didn't know how to eat while they were pregnant, or she didn't know how to take care of them once she went home. We just really want to be able to prevent some of these things by teaching the mothers on their level. They're defenseless. They can't say when they're sick. They can't say when something's wrong with them. They're the most innocent of all human beings. They can't fight for themselves. Somebody else has to fight for them.
Grace, she travels outside.